Western states are trying to contain a measles outbreak. Idaho has yet to see any cases from this most recent outbreak, and doctors and state health officials want to keep it that way. Local News 8's Chris Nestman is live at the health department. And Chris, what are doctors saying to prevent this from coming to Idaho?
Yeah, Carol, the biggest thing they're telling us is to make sure your kids are vaccinated.
The reality is we shouldn't be seeing measles at all. It's a product of, frankly, uninformed parents or perhaps irresponsible parents. It was all but eradicated in our country.
That's what Dr. James McGuire is saying about the current Western measles outbreak. A few young kids picked up the disease in Disneyland in December. The disease has since been reported in several parts of California, as well as in Utah, Colorado, and Washington state. Doctors are watching the outbreak closely to make sure it doesn't surprise us here.
So if we were to have a case of measles in our area, the doctor's offices, physicians, laboratories that diagnose those cases, or if they have a suspect case even, they will call us and notify us so that we can track those illnesses.
Doctors say the hardest part in preventing measles is that it spreads very quickly and is very infectious unless people are vaccinated.
Measles has a high transmission rate. About 9 out of 10 people can contract measles if they're susceptible to it. So the best thing to do is to get your vaccination.
I will only do for my clinic or my patients what I will do for my own children. And I assure you, all of my children are immunized, and they're thriving, healthy young children.
Now, even though children and the elderly are those who are at the most risk for getting the disease, doctors also suggest that adults who haven't had the vaccine in over 40 years should consider getting a booster. Reporting live from Idaho Falls, I'm Chris Nestman.
All right, thank you, Chris. Hopefully we will not see any more measles cases at all in Idaho. All right, if you signed up